Good evening, everyone. Um, Thank you, Dr. Sachin and Crack the Wellness Code for inviting me here for our seniors and just to provide a education about the dental issues and TMJ and the sleep disorders, oral health education for senior adults. I'm currently part of the Dugoni School of Dentistry in San Francisco. My specialty is orofacial pain and oral medicine, temperamental joint, and sleep disorders as well. Why our smile is so important. Smile gives us a value, big value. So share the smile. A smile is the light in your window that tells others that there is a caring, sharing person inside and is free. So saving senior smiles is very important. And life is short, but a smile takes barely a second. There's no cost for smiling. So there's a saying, keep smiling. Every tear has a smile behind it. Healthy smiles for life. A good neighbor is a fellow who smiles at you over the back fence but doesn't climb over it. Again, there's a saying, a good neighbor is smiling. Smile. If a neighbor is frowning, nobody is going to speak to that neighbor. But if a neighbor is smiling, it's an indication that they want to be your friend. Smile not because it costs you or not because you can make someone smile and make their day. So smile, please. So why our smile is so important? The benefits of good oral health includes economic, social, psychological, and physical health. And chronic health conditions create a massive burden on the health of seniors as well as the entire healthcare system. So it is very important to have a routine and regular dental care for seniors. Not only it prevents the periodontal diseases, we call it periodontal disease, back home we call pyorrhea, periodontal disease, but also helps to satisfy patients who are at significant risk for more serious systemic conditions. So there is a correlation between oral health and systemic conditions as well. A smile is the light in your window that tells others that there is a caring, sharing person inside. So it has been estimated that 75% of seniors will enter long-term care facilities with a majority of their natural teeth. So it gives an indication that more and more people will be having their natural teeth. It is well understood that patients with good oral care require fewer healthcare dollar expenditures, and the systemic conditions that are impacted either coincidentally or casually by oral conditions are atherosclerotic diseases, pulmonary disease, diabetes, osteoporosis, and kidney disease. The health of the mouth, teeth, and gums is important to overall health of the body. And a clean, mouth is a gateway of entry. So everything is entering from the mouth. So if the mouth is clean, a clean, healthy mouth can contribute to wellness and better quality of life. So what are the issues related to oral health and hygiene? Diabetes, blood sugar regulation, daily plaque control, brushing and flossing, denture care, cancer and tobacco use, visit a dentist for head and neck screening. Risk factors, what are the risk factors? Age, tobacco use, alcohol use. So what are the issues related to oral health and hygiene? Arthritis that affects dexterity and strength. Say in seniors, they have arthritis, say if they have arthritis in their hands, that affects their dexterity and strength to brush. So if they cannot hold the brush and cannot clean their teeth, that definitely affects their oral health and oral hygiene. So if they have a dexterity issue, use a toothbrush with a thicker handle, attach handle, duct tape or something in a rubber ball to handle. Use an electric or powered toothbrush. Or there are floss holders. If they cannot use the regular floss, there are floss holders as well. Um, what are the other age-related issues? Some medication seniors taking has a side effects such as altered taste, dry mouth. So if those are the issues, stay hydrated with water. There is a mouthwash called as biotin, biotin toothpaste, and there are rinses. And again, stay away from sugary drinks, alcohol, and sugar plus a lot of sugary drink. And since side effect of the drugs, dry mouth, it causes more cavities. Again, nutrition, crunchy vegetables and fruits like carrots and apples are great snacks. One more time again, don't eat sugary snacks or drinks, especially between meals. Why? Especially in between meals. Look, saliva works as lubricant and it has a cleansing action. So if you are having a sugary snack just with your regular lunch or dinner with regular meal, is still okay. But in between meals, because a lot of saliva flow during the lunch or dinner main meal. So should be fine, but not in between. Whole grains, fruits and vegetables, lean meat, fish, poultry, and beans. And again, try to limit fried foods and processed foods, soft drinks and juices. Most commonly in seniors, osteoporosis is very common. What is correlation between osteoporosis and oral health? Osteoporosis is an imbalance between bone loss and formation that results in decreased bone mineral density. And since it's a decreased bone mineral density and decreased bone density in the jawbone, the mandible jawbone, it leads to greater alveolar bone resorption. The alveolar bone is the bone where the denture is resting. Alveolar bone, we call it alveolar bone, is the bone of environment. Means if there are teeth, the bone is there. As soon as the teeth starts coming, if extraction, the bone starts dissolving. So if a person in senior age, if they have decreased bone density, there is a greater alveolar bone resorption, increasing the depth and number of gingival pockets, which in turn allows invasion by periodontal pathogens. So somebody has pyria or deeper gingival pockets that has more bacterial pathogens, and that leads to local and systemic increase in interleukin 1, which is a known predictor of bone loss. Correlation between periodontal disease and osteoporosis. Osteoporosis and tooth loss are health concerns that affect many older men and women, and osteoporosis is associated with several risk factors, and increasing evidence suggests that it may be associated with the reduced jawbone density, tooth loss, inability to create functional dentures. Since if somebody doesn't have a good foundation there, I mean to say the alveolar ridge there, there's difficulty to create functional dentures. And again, there are temporomandibular, the jaw joint disorders. And women with osteoporosis are 3 times more likely to experience tooth loss than those who do not have the disease. Systemic loss of bone density in osteoporosis, including that of the oral cavity, may provide a host system that is increasingly susceptible to infectious destruction of periodontal disease. So here's the thing, we can see on the left side, that's the normal jaw. And on the right side, we see an osteonecrotic lesion. We can see the thinning of the bone there. Again, osteoporosis and oral health, bone loss in the jaw and around the teeth. We can see here, bone loss in this area, tooth loss, loose or ill-fitting dentures, gum disease. Here is the radiograph. In the radiograph, you can see that there's a generalized bone loss around the teeth. See, there is no healthy bone around here.